a fulfilling life despite having this illness. So it is in line with the Convention of Rights for Persons with Disability. And this is what makes it, or rather what makes it be called quality rights in mental health. So what WHO has done is they've developed, okay, there's some noise. All right. What WHO has done is that they've developed a package for training, and they also have guidance materials. That means that even if one takes the training and goes out to train others, then they are able to understand the background or the backdrop against why what informs this training, and be able to understand how best they can deliver it to the people, to their audience, in a way that will make them understand and be able to actually adopt what they are learning, and capacity build those that they will be building capacity of, for lack of a better word. So at the end of it, it's how we can ensure that, again, rights of persons with psychosocial, intellectual, and cognitive disabilities are adhered to. And how this is done through this training is, the beauty of this training is it's like a game. So if you've ever played Candy Crush or played Super Mario, then you will also enjoy it, because just the way these games are designed is the same way the training has been designed, to make it interesting. And then the beauty of it also is, as per the level you are at, then you get to interact with other people around the world who are in that level, and get to discuss what happens in Kenya as per whatever that level is taking you through, what happens in Ghana, what happens in Australia, and so on and so forth. Then we get to have a bigger picture of how it looks like in other countries. And I must say that when I took the course, I was quite impressed, because I realized that I had all along thought that in Africa, we are at the base of it all, that we are the worst. But then I realized that some European countries were doing much worse than we are. So I realized then that this is something that we can actually adapt, we can actually make use of, and we can end up having persons utilizing services who are happy and contented with the way they are receiving these services. And that means that part of it is destigmatizing mental health, encouraging people to have behavior that whenever they feel there's a problem with their mental health, they would be courageous enough or bold enough to want to seek services, rather than to want to stay in their seats and say that because of stigma or discrimination, I fear what I will go and meet out there. So what WHO has done is it has focused on 5 themes that are also derived from the Convention of Rights for Persons with Disabilities, otherwise known as CRPD. And one of the themes focuses on the right to an adequate standard of living. I think part of this presentation is going to delve deeper with the next speakers perhaps. But just as a highlight, is just to ensure that persons with these psychosocial, intellectual, and cognitive disabilities are able to enjoy the way they live. That means that, for example, if they're admitted in hospital, then the issue of privacy, like if you'd go to a maternity ward, you can find that there's privacy, that you can maybe draw a curtain and separate yourself from the next patient. So also allowing for such kind of privacy for persons who have this disability. Again, if you go to the wards, you may find, for people with other physical illnesses, you can find them with a small cabinet where they store maybe the Ribena or the Lucozade that they've been brought for. So we also want a situation whereby for persons with mental health conditions, they can have that sort of arrangement whereby they can keep their belongings amongst others, but just to make sure that in terms of their standard of living, that if you're repainting the maternity ward, for example, then you also repaint the mental health ward. Don't look at it as a situation whereby If a patient maybe scratches on the wall and the paint comes off, so you see that as a reason not to paint, or you see that as a reason not to repair any broken windows or any broken beds, or not even give them any new linen as you compare to the other wards in the facilities. Then also the second theme, which is also drawn from some articles in the CRPD, is enjoyment of the highest attainable physical mental health care. And that means a situation whereby we actually have people who are trained in mental health care. We may not have specialists, but at least we have persons with basic knowledge that they can be able to identify mental health issues in their patients. They may be able to give some intervention and even follow up, and just to make sure that their patients are doing well, just the way we see for the other types of illnesses. And thirdly is the third theme focuses around the right to exercise legal capacity. If you look at even part of what our constitution says, is that persons who are mentally ill, they don't have a right to own property, or they may not be allowed to marry. But that is not correct. The reality is they are human, and if we compare against the CRPD, it says they are human. That's the number one thing. For as long as it's a human being who has a mental health condition, they should be allowed to own property. Sometimes you find families coming in to ask or to say that we have a family member who has a mental illness, and maybe their parents are deceased and they've left them some property. So they feel like this person will not be able to manage their property. So they want situations whereby this property can be transferred to the other family members, and this is not proper. We all get sick at times. We get colds, we get stomach aches, we get headaches, and we may even develop some chronic illnesses, but that does not stop us from being able to maintain or take care of the properties that we have. So we need to also allow persons with mental illnesses to own property, to decide what to do with that property, amongst others. And the fourth article, or the fourth theme, focuses on freedom from torture. And just like Charity mentioned, that in as much as parents may bring in their child tied in ropes, and sometimes you may find that this person has been beaten up before they arrive in hospital. So we want to see a situation whereby we do not carry out these practices, that we engage in conversations that can help us, or that can guide us to know what do we do in the event that the person their illness comes back. How can we better help them? And I think this will also be discussed as part of the presentation, where we come up with things such as advanced directives, whereby this patient gives you the rights of treating them in a particular way when they're acutely ill and they're not able to make decisions for themselves at that point. So that instead of, they could agree to be tied up, to be taken to hospital, or they could say they would want to be treated in a particular way. And we are a situation whereby when they give these advanced directives, then the persons who are the custodians are able to follow it up to the latter, just the way they have requested for. And last but not least is the theme that focuses on the right to live independently, to be included in the community. And this just means that in as much as one may be having a psychosocial or intellectual or cognitive disability, it does not mean, especially when they've come of age, that they cannot live by themselves, rent their own homes, or participate in community activities such as, be it worship, be it attending events, be it even voting, for example. So we need to see a situation whereby if the person feels like they want to live by themselves, then they're allowed to do that, so long as it is something that they can also manage. It's not just so long as, but even as us as the audience here, the participants, when we are able to live by ourselves, we do so. So we need to afford the same to persons with this disability, unless they come and say that, for example, I need extra help, or I may need help in a particular way, then that's different. But we need to give them that opportunity to even do things for themselves, participate in social activities like voting. You find situations whereby they're not allowed to even have identification cards, which is not okay. It is not proper. It doesn't mean that because they have this mental illness that they cannot be able to make a decision as to what type of leader they would want to choose, whether this is a national voting or maybe even voting in an organization or a church or whatever place it may be. So we need to be able to allow them that space to live independently and participate in community life. So for us to be able to achieve this at different levels, that's in the community, in facilities, and even in homes, we need to agree that it is just an illness. And I like what Charity has said, and Charity is a testament to all this. And she confirms that, yes, she was diagnosed with a mental illness, but see, she is the convener for this meeting. Most likely, a majority of us wouldn't have thought of even gone ahead to read over the internet whether there's something like quality rights. Maybe most of the time what we do is just spend a lot of time on Twitter or on Facebook and the others. But what Charity is demonstrating to us today is that persons with mental illness can be able to lead, can be able to bring people together, can be able to do so much for the society, and we need to allow them that space to be able to do this. So the Quality Rights Toolkit looks at those 5 areas that I've mentioned, and when it comes to facilities or even in the communities, it looks at a situation whereby a committee can be set up of persons who would assess the facility or even the community to see whether they are able to identify the gaps within these 5 thematic areas. And as they identify these gaps, then they're able to come up with recommendations and follow up to check whether these recommendations have been implemented, to mean that for the person with a mental illness who accesses services in these facilities or through these communities, then they're able to get healthcare or mental health care to the highest attainable standard that is there. So I would like to stop there and then just hand it back to Charity.
Okay, thank you, Naomi. I should probably mention that I have been Naomi's client, and I am a great person because of Naomi's contribution to my life. I'm very happy that now she gets to do this at national level. And so I wanted to be able to release her. So I had left the second part of my presentation, which is about quality rights, for her to complete first. So thank you, Naomi. Excellent, insightful conversations. And we look forward to working with the Ministry of Health more, even in future webinars and programs. So before I continue, I would like to sincerely apologize. Okay. All right. We have people who are actually in the waiting room, but it seems the platform can only accept 100. We're very excited to have this big number, and I request that you share with them that we will share the recording with them after. Now, allow me to share my screen. Okay. Can everyone see my screen? Yes, the confirmation.
Yes. Oh, yes, we can see.
Okay. Fantastic to hear your voices as well. So this is a program, as we have mentioned, by the Ministry of Health and a civil society organization known as Basic Needs, Basic Rights. which is now
Oh, Charity, we can't hear you. I don't know whether it's from my end, but we seem to be having a challenge.
I also can't hear her. So
Oh,
it's
you also
just to your side.
okay. You're also on mute, Charity.
okay. Sorry about that. So let me go back to the screen. Okay. Yes, so I was just giving a brief background on basic needs, which is partnering on this program. Otherwise, this program is actually open to anyone who would like to facilitate it. So I hope that the next time we are having this screen, we'll be talking of this as the hosts. So in terms of the team, Dr. Nasri Omar, who has today been represented by Naomi Onyango, is in charge of mental health systems and policy. She's the focal person for quality rights at the Ministry of Health. We have Judah Njoroge, OJ, who run the youth engagement, and I currently in engaging health professional associations and institutions. So our objectives are to actualize a rights-based approach or approaches in the delivery of mental health services, integrating this in research, training, and internship activities, especially for institutions like yourselves, influencing QR trainings to be incorporated as required learning and later in the curriculum. Actually, we are engaging the newly formed Kenya Board of Counselors and Psychologists, and they are looking to have QR as a mandatory training for all psychologists and people working with mental health conditions directly. We are also, like Naomi mentioned, we have a toolkit to assess facilities. So that means assessing any facilities that are providing mental health services. And this can also be campus mental health services, which I have seen different campuses have different models. I am aware that you have Equity up here, and so we would do the assessment with them. We also want to celebrate best practice. So we're looking for partners so that we're able to celebrate best practice through giving awards for institutions, for individuals, for civil society, for academia, research, and also with the commitments that we ask people to take, that we are able to celebrate those that are very innovative. And so our approach is to capacity build mental health professionals to be our quality rights champions, training faculty, undergrad, masters, PhD, and even our alumni. Actually, we are also being joined by some alumni today who saw the poster and said they'd like to join. Then we would want an essay written on QR course completion, especially for psychologists, but all of us will be requested to have commitments that we say, I will promote advocacy, that is rights-based, and what you can practically do for your community. And lastly, to integrate quality rights in all facilities and services. Now, the course content, and this is the main thing we need to discuss today, is that we talk about human rights, the introduction to human rights, the history, of looking at where did this human rights start. And then we'll also talk about the relation of human rights with mental health and disability. As Naomi mentioned, persons with psychosocial disabilities who are the ones with mental health conditions, plus intellectual disabilities, which most of us know as special needs, autism, cerebral palsy, and so on. But also legal capacity. I think one of the things we all struggle with is when you say someone is of unsound mind, what does that mean? And what does that mean legally? I know we have a big case at the moment about a judge who is said to be of unsound mind. So we're looking at what is the legal capacity of persons with mental health conditions? What is the right to decide? And how exactly do we actualize that in our country? There's also ending coercion, violence, and abuse, which, like I mentioned, I saw a lot more when I was a new patient. Most of these things have been addressed and continue to be addressed at Mathare, but of course, we need a lot more in other facilities. We recently launched a report, and this is the Ministry of Health, Kenya National Commission on Human Rights, Basic Needs, Basic Rights, Kabarak University. They have a very vibrant legal program that they have released a book on criminal justice and mental health, but also, they are part of facility assessments for Mathare, Port Reitz in Mombasa, Gilgil in Nakuru, and Moi referral. And so there are many more initiatives that need to be done in those three facilities, and also in outpatient facilities. We are talking of community mental health. We want to move away from hospitalization and offer community mental health. Nairobi County mental health services have 40 facilities so far, which are outpatient and run once a week, and they run psychotherapy. So this is at the community health level: Waithaka, Lunga, Jericho, Kibera DC, and so on. So the toolkit also advises how to look at outpatient facilities. And then we also look at quality services, and that's where the toolkit comes in. Community inclusion, which, as Naomi was talking about education and employment, our access to education and employment, and also inclusion in leadership, inclusion in voting, and also now just mental health, well-being, and recovery. So what are the benefits of the course? We alluded to this when we sent the posters, and we said that the course content has been developed by WHO, and they have certification at the end of the course. The course is free. It is accessible and convenient on a digital program. So once you register for the course, and we will share the link in the chat, but also we will, the message that this invitation came with had two links. One was to join this meeting, and the other was to register for the course. So when you register for the course, you're able to access the content on your own at your own convenient time. And this content is in print, so there are things to read, including the UN Convention of the Rights of Persons with Disabilities. There are videos from different countries as people talk about quality rights in different perspectives across the world. There are challenge activities. You can challenge anyone across the world to do quizzes together. And on average, most people take about 1 hour per module. So once you log into, or you register for the course, you will find that there are 6 modules. So each module has print and videos and challenge activities, and has a small bar that's green at the bottom. So when you finish all activities, the green bar is full. And so when you have 6 green bars, you automatically receive your certificate. And so once, so that's what we're talking about, attaining the WHO certificate. It is automatic after you finish your course content. There are people who are very eager and they finish it in a day, but we did meet with student representatives from the masters, undergrad, and PhD. We met representatives, and they felt that the best model that would work for Daystar is for people to do 1 module per week, so that in 1 week, at least you're able to go through your reading. And then one of the reasons why we are doing this as a group is many people, including myself, started the course and then left it halfway. And for many of us, the reason was that it was boring to do it alone, or there are things that we want to discuss with others. So the reason why we introduced the cohort approach is for us to be able to come together and say, from module 1 and 2, what are we learning? So we will have panelists who are students and faculty, so that we are able to discuss the content. But we are also saying that we want you to start your careers on foundational rights principles. It's harder for those who've practiced for many years and they are just learning now to include rights-based approaches. And then we also want Daystar to globally and nationally align to implement human health and disability rights. We will be inviting Daystar to join the QR committee so that you can share your experiences after doing this course and encourage other universities to sign up. Lastly, I had talked about QR commitments. So we asked, after you have learned QR, what is your commitment? And this is one youth group. We have youth groups across the country who've been taking up the course. So I will create awareness of QR in my community. That's a basic commitment. I will educate people living with mental illness about their rights. That's another commitment. I will respect the opinions of people living with mental illness. A lot of the youth groups we've worked with are in rural and urban low-income settlements, but they have still been able to understand the course and participate. Asante sana. So at this point, I will request Chris, who is a master's student at Desta University, to share with us his experience in quality rights when he joined the first time and now as he's taking up again. Chris Limo, please speak to us. And then lastly, we will have Dr. Jared Menecha, who will speak on behalf of faculty and will give us his keynote address. Thank you.
Thank you. Thank you. Thank you, Charity. I hope I can be heard. Yeah, it's good to be here. And for me, I wear many hats in this presentation today because, yes, I'm a Destarian. I'm a master's in counseling psychology student. But also, I do live with a mental health condition. I live with clinical depression. And it was first diagnosed 20 years ago. And I believe I had it from before when I think about it. But at that time, when I got the diagnosis and I was mentioning to people, they said, how can you be depressed and you're single and you're not married? You know, so I don't know what even that communicates about marriage. And so fast forward, I got treatment and therapy and medication for another 6 years. Then money ran out. You know, I couldn't afford it anymore. And by that time had, you know, joined church. And so it went, in my view, I thought it was, you know, it completely disappeared. Now, fast forward to 2020 during COVID, a graduate student at Daystar, seeing a therapist at Nuru Counseling Center. Many of you may know it. And one time my therapist said, Chris, I'm sorry, I cannot continue seeing you until you see a doctor. Because what you're presenting is just gloom and doom. And the funny thing is, everything was working. You know, everything else in my life was working. And this time I was married. And, you know, now I was also feeling embarrassed. Now for a moment, I almost felt embarrassed to share about it because this time I was married. You know, now I have an official reason to be depressed, if that's what the perception out there is, that, you know, you should only get depression if you're married. But it had nothing to do with my marriage. If anything, the kind of support I received and receive from my family, you know, because now they understand, has just been amazing. And so I did go see a doctor, and, you know, and when I was approaching this course, I was wondering, what does that do for the different population now that compared to what maybe Charity and Nancy have alluded to? What about people with private insurance, people who can pay, you know, the 5,000 shillings for therapy? What does that do? Are they also included in this quality rights thing? And then now on top of that, the other hat is that I'm also training to be a practitioner. I'm already practicing. I'm in private practice, and yes, I'm being supervised because I don't have the full credentials. So I'm being supervised by a credentialed mental health practitioner. So, you know, so what would that mean? You know, quality rights for me as a practitioner and as a user of mental health services. And so when I was doing, and also, you know, I was in that, I think 3 years ago, a lecturer told us about this course and I signed up, and I was in that group that did not complete. So my hope is right now to complete. I've started on the human rights module and getting to understand, especially now, you know, when I'm seeing private clients, but even when I'm now a user of, you know, I'm still on, now I'm on medication. And now I don't shy to say, because it's a normal, abnormal condition, if that makes sense. And And now when I even feel something is coming up, now I know I have the right to express myself. I think there's a principle there about respect and justice and equality and dignity, that I can express how I'm feeling, that I feel like I'm about to sink, and I need you to know that. And to me, that I did not think it was a right. I thought asking to be treated with dignity, I thought it was a privilege. I thought asking even treating people, clients with privilege, with dignity, I thought it depended on how much they are paying. Because yes, I do give a lot of pro bono services, but I like the idea that it's universal. Human rights, it's not a law, yes, the Declaration of Human Rights is not a law, but it's a declaration. And for me now, as a practitioner, I'm aiming for that. So then I'm excited, especially I'm on my way out, I hope. I hope I get to wear a hat in November. But I want to go out knowing that I'm going out to a hurting world, but I'm also capable, one person at a time, one client at a time, to reduce that hurt. I mean, in fact, eliminate that hurt because of my background, my training, and then the credentialing. So for me, that's what I wanted to just demystify mental health and mental illness. And so thank you for this opportunity to be able to share that and to be a part of this team. Thank you.
Thank you very much, Chris. I am always very encouraged by your story, and we thank you for your candor and even for mobilizing people. You've done so much in the background together with other student representatives. Now, at this point, I would like to introduce Dr. Jared Menecha, Head of Psychology and Counseling at the university, to speak to us, to give us the keynote address. In case you have any questions, please put them in the chat and we will address them. Thank you.
Okay, thank you so much, Charity, for this opportunity. I'm very delighted that we're in this forum, and we have actually surpassed what this Zoom can actually hold for today. And I want to thank you people. I want to thank even my fellow faculty from Daystar and our students actually to join and work together in this. And I want to assure everyone that is Daystar University, we are here and very committed to walk through this training and ensure that at the end of the day, we become champions of quality rights. Just by introduction for in case we have anyone joining us and know who I am. As Charity has said, I'm Dr. Jared Menecha. I'm the current head of department, psychology and counseling. At the same time, I'm actually a clinical psychologist. I'm a certified practitioner, and I do a lot of client work. And I can actually agree with what has been said in this meeting, that we need actually to be champions and make sure that we are at a point of ensuring that there is actually a quality rights. But just the same, ladies and gentlemen, I want to actually say that I'm very delighted to be in this meeting. And we are here dedicated to advance the rights and well-being of individuals living with mental health conditions and also psychosocial disabilities. So it's a privilege to see so many of us are joining this particular training. I know we started this journey a few weeks ago with Charity and also Chris, who is here, and a few others who actually were in the very first meeting. But today we are here, quite a number of us. As I've said that we are here, both students and faculty, and we have a shared commitment to promote dignity, equality, and human rights for those often marginalized by our society. So it's my belief that a WHO Quality Rights Initiative is a beacon of hope in a world where all too often individuals with mental health conditions have been stigmatized, discriminated against, and denied their fundamental human rights. Therefore, through this initiative, the WHO has taken significant steps towards rectifying this injustice, working tirelessly to ensure that every person, regardless of their mental health status, is treated with the respect, dignity, and fairness they deserve. So I want to believe that we have started a very important collaboration between Daystar University, the Best Needs Kenya, and the Ministry of Health. So I want to believe that this training is a collective effort to build a world where mental health is not a source of discrimination, but a facet of human diversity, where seeking help is seen as a sign of strength, not weakness, and where every individual's right to live a full, meaningful life is recognized and protected. Brethren, we need to translate the words and principles into tangible, positive change. So it's about turning the rhetoric of human rights into concrete policies and practices that uplift lives and empower communities. As we need to understand that, mental or having a mental disability is not a choice. It's not a choice that any one of us can be found there tomorrow. So the motivation of undertaking this training is actually the stories that we have heard, and the stories of countless individuals who have faced stigma, discrimination, and violation of their human rights. So as narrated by Charity, let the experiences of such people fuel our commitment to change, to create a world where no one has to suffer in silence, where no one is left behind. So I believe in this training, we will purpose to engage in meaningful discussions, share best practices, and forge new collaborations. We will learn from one another, and together we work towards a future where mental health is integrated into all aspects of society, from healthcare to education, from the workplace to the community. And this will be a great milestone in the transformation of our society. So let us all purpose to break the barriers that have held people with mental health conditions back for a long time. So I believe that we can advocate for policies that protect their rights and provide the support they need. So together we can change the narrative surrounding mental health from one of despair to one of hope and resilience. So it's my belief that as we start this a very important training, we'll allocate it more time. I know with our students, there is the academic work, but I've emphasized from time to time in my classes, in the different forums, how important this training will be to us as faculty and students, especially here at Daystar University. I want to assure everyone that we are committed to be the champions, as I've said, and make sure that we are there to make sure that we leave a mark in the world when it comes to issues to do with quality rights. Therefore, let this training be a catalyst for change, a turning point in our journey towards a more just and inclusive world. So it's my hope that as we start today, we are going to actually look at it in a more positive way. We energize ourselves. And as shared by Chris and also Charity, that yeah, at times you might feel like giving up and maybe opting to stop. It's my belief that we are not going to stop. We work together. I want to encourage each one of us that we be in our groups, we discuss. Let this be a very important discussion in our households, in our classes, everywhere that will be. And as mentioned by Charity, that at one point, we believe that we are going to have this incorporated in our curriculum. That is the curriculum of psychologists, that even in our courses, we should actually learn about quality rights. So I believe that we are here for a purpose, and we'll work together to make sure that things work. So I want to believe that in case we have people who have any questions, we are here to support you for any clarifications and anything that you may need to be supported in. So we want to start together and actually complete this training together. I know we have many students, even from other universities, who had wanted to join this. Some came to the office here because they had heard about this. We want to thank Charity for remembering us that Daystar University is here and is ready to go through this. And also actually the Minister of Health for actually partnering with us in the entire process. Otherwise, with those few remarks, I want to wish you well. I know with the Daystar, we are known of performing, and we are known of being resilient. We are known of being purposeful. We are intentional. So I want to encourage our faculty and our students who are here that please let us start together. And let us even have more joining. I know there are many students who I've seen at the chat who are logged out of this meeting. And our target was over 250 students. And I'm sure by now we are at that particular point. Otherwise, with those few remarks, thank you. God bless you. Back to you, Charity.
Okay, thank you, Dr. Menecha. Those are very, very insightful remarks. And I must say that even when I thought about this, the first university I thought about was Daystar for 3 reasons. One, my mother used to put me on a table at Daystar to sing for women in a fellowship that used to be at Daystar called the Women's Aglow. So it's the first university I heard of. But also because we've worked with Chris quite a bit, even in, you were speaking at ACK Madaraka, and he spoke so well from lived experience and also as a psychologist. And so he is a very good ambassador. And I'd like to see many more of us being able to do this. This Zoom is the paid version. And so I'm surprised that we're not able to have people in, but we will rectify that. Now, in terms of where do we go from here? First, let me address some questions on the chat. Could work it out, especially in the future where certificates could be by the institutions involved, say Ministry of Health, Daystar, WHO, and basic needs, basic rights to make it heavier. Now, even for WHO to provide certification for this, it took very many loops and jumps, and we have worked with the Ministry of Health even to do other trainings like the WHO mental health gap action plan, which to this date they have not provided certification. The Ministry of Health and WHO are both very careful about who they give certification for what. And that's also because, and one of the reasons why the Counselors and Psychologists Board of Kenya was put in place was even to, create very clear boundaries in terms of who has done what. And one of the things we are discussing is, even as we train counselors, because most of them do not learn about mental health conditions, it is the counseling, but they do not have mental health conditions. And, if they go to a patient or, an institution and say, I am trained in mental health by WHO, for someone, they may not try to look at what. So I know for sure that that is a difficult thing to do based on the requests that I have seen with various organizations. However, because we, give this feedback as Africa, and the suggestions that are there. We will put it forward. It would take time, but it's something that we can put forward. Another one is, do we have a designated time to work on the module on a daily basis, or is it according to our flexibility? It is according to your flexibility. Like I said, there are people who even just start in the morning and by 2 they are done with all modules. But we had a discussion with student representatives, and we felt the model that has worked, especially for those who are, both studying and having full-time jobs and other responsibilities, would be that we give people 1 week to find their own time to do the module. And then after every 2 modules, we will have a webinar to discuss. Because one of the things about quality rights is we talk about things that are uncomfortable. If we talk of, that people should have the right to voluntary treatment, what happens to you when you have a patient who is severe and is probably not very manageable, and you're being told if they do not agree to treatment, they do not go to hospital. And so we want to have those very candid conversations. And so that is why after every 2 modules, we will send a link for everyone who we trust will have finished by that time to log in, and then we can hear from Dr. Menecha, from Chris Limo, from Felix, and the many people I have been meeting across this journey. What are you hearing? What will we do about these things? So yes, you do it at your own time, and then we will have discussions. So we will have 3 webinars for discussions. So after module, so this week will be the start of module 1. And so today is Wednesday. Yes, so up to Wednesday. So we can, up to Wednesday, module 1, and then we can plan for a meeting after the 4th of September, where we will talk about the 2 modules together. Now, having done this course with different groups, I'd like to encourage you each time as you do the modules, just there's a catalog page where you go and you see how far are you. So just ensure that your green bar is full. Yeah, when your green bar is full, you've finished. Otherwise, what happens is you get to week 6 and you think you've completed, and then you're taken back to module 2. So when you get there, then, and by the way, there is a link which I'll look for quickly, where we have a video that you can watch. So let me find it quickly and put it in the chat. And the other question is, what time or day will the training be? I think initially we had found this 2 p.m. to be good because especially for undergrad students, they do not have a class at this time. So that is the time that we had seen would work for majority of people. But we will have an optional class because for master's students, they felt that, or post, let me just say post-grad, they felt Wednesday afternoon will not work for them. So we will have an alternative class on Saturday mornings at 9. So that means even if you're an undergrad, but you're available on Saturday, that's fine. We are creating flexibility by giving 2 classes. Yeah, so we will have Wednesday 2 p.m. and Saturday 9 a.m. after every 2 weeks. Yes, but we will continue to work with Dorothy and Dr. Menecha and the student representatives to be updating you. So before we have the next meeting, we will put out posters and then we look forward to you coming. Charity, maybe you can share your contacts for the sake of when one is stuck when taking courses. Now, we have 2 student groups. One is for undergrad and another is for postgrad. Probably I'll ask Chris to help me with this one. What would be the best way to get questions to the student rep groups and then we respond together? Or is there an email probably that we can give where people can send their questions? Because sometimes even when we are asked, we have to consult within the student leaders. So
I agree. My encouragement would be sign up for the course. You will possibly find that how user-friendly it is. Yeah. because the idea of getting stuck before you've signed up may be a bit premature right now, but just sign up for the course. And we'll keep sharing anyway on the community groups, the way we've been mobilizing. Maybe I know there was somebody who suggested that we will also form a WhatsApp group of all the participants, because that could be another option. Yeah.
Yes. That's actually a good
that's
idea.
Now so on the back end of the basic need rights, registration was important so that your emails are picked, and then we are able to, send message. They are able to send a message to everybody easier. So they're creating a WhatsApp group for those who have registered for the course, and register for the course. You will find that it's really, really user-friendly. Thank you.
Okay, maybe Charlie, also to add to that, what Chris has said, that's very important. And I would actually encourage that we form that WhatsApp group. We share the link to the community group, right? I'm sure there are people who are here. In fact, I've seen someone asking me whether the meeting has started. So,
Okay.
I know there are people who are not here at this time, but they would like to do this course. And once we do that, we can have that group. I want to encourage us that we have as many discussions in that group, the way we normally do in other forums, so that when we shall be having the webinars, we can also even pick some of those questions and try to discuss about them during the webinars. And because we have different experiences, I'm sure we'll be in a position to help. And I want to encourage our students that myself, I'm taking this course. I'm taking this course and I'm going to get certificates, same as you. So I want you people to be with me in class. So don't leave. I'm here to encourage you that we are here. And also our faculty, the department, we have so many people. We have my colleague, Irene is here, Dr. Naomi, we have Sarah, we have even Dr. Muriungi is actually joining today that she's away, and many others who are going to do this course, plus many others. You'll see a number of more than 20 faculty from Daystar who are doing this course. So it's a good experience to learn together. I want to encourage you people that we work and finish. And by the time we get our certificates, we'll actually now take a group photo and show the Daystar community that this is what we have done, and we are indeed champions in this.
Okay, well said, Daktari. Yes, so I think what we will form a WhatsApp group. We'll send the link, just as we have been sending the links to the meetings, and we will encourage you to join. As Daktari has said, it does help to keep talking about it, and you will have several aha moments as we do the course. But otherwise, I have sent again the registration link for the course so that you can register. Like we mentioned, we have people who with low literacy levels who have been able to do this course and complete. Most of our youth groups are in very low income settlements, whether rural or urban. I think the last what is this called? I think the last graduations we have had have been in Kayole, Kibera, Kilifi, and so on. So I agree with Chris that it's pretty much an easy course to navigate. And as you will see, it's done across the world. You will see people challenging you, and you can challenge people, to answer different questions. So I think we will address the rest in the WhatsApp group. I'll also share the link there for the video. Eddie Kimani, who is a former journalist, was part of the first people to join this course, and so he did a video on how he was, able to navigate, and so we will send that on the group. Otherwise, I don't think there are any questions we have not addressed yet. Okay, please repeat. What did you say? Each module per week, but then you mentioned about every 2 weeks. Okay, so it is to say that the course has 6 modules. Each week we are giving you one. We are giving you 1 week to finish each module. So when you finish week 1, you finish the module in week 1, and in week 2 you do module 2. Then we will have a webinar together to discuss what it is that we are learning. So the learning is every week, a module per week, but after every 2 modules, we will have a webinar. So I hope that that is clearer. Create a WhatsApp group. We will do that, and we will share on the team. I just want to look I'm able to form a quick one. Chris, do we send later or we try to quickly form one now?
Okay, I don't know. We can even form, if we form now, I don't know whether it's someone who has formed, eh?
Just give me a minute.
Because in fact, or what we can do once we form,
yes,
because we have all our students in one forum,
yes,
we can share that link with them.
Okay.
Yeah, of course. Yeah. that
Okay,
is-
all right. That's
All right,
easier.
okay.
Okay,
Yeah.
so we will follow up an email to thank you for coming. In that email, we will send the recording, which you can listen to again and you can forward to other people. We will put the WhatsApp link there. And from there now in the groups we can speak. So this is to repeat again that this is the first time we are doing this as, you know, as a cohort for a university, which is, you know, probably the biggest cohort we will have, because the others have been youth groups. So this is to say we are learning together. Yeah, we are in this together, learning together. But from this, we will be able to now develop a good working system for universities. Otherwise, mine is to say asanteni sana for joining us today. We will ensure that for the follow-up meetings, we can host more than 100. We thank you for your participation. I want to really thank Dr. Menecha and the faculty team, including some counseling staff that we had in our first meeting. I want to really thank the student representatives. We have a planning WhatsApp group for both undergrad and postgrad. Asanteni sana. Thank you, Chris, for bringing us together. And we look forward to having this experience with you. Please do the course. Please openly say things. I know there are things about mental illness that are very sensitive, but we'd rather say them and learn together. So we look forward to having authentic conversations. This is me who's been joining you from a very sunny Kisumu. Sorry, we've had a bit of, you know, that probably, you know, where I looked for a place with the most internet. But thank you for your patience and your understanding. We look forward.
Hello.
Hello.
Charity.
Yes, Colin.
There is a question you haven't answered.
Okay.
There is a question in chat.
Okay. Is it there are many people here who are not our students and would not want to miss out? Is it that one? Is it open? Oh, okay. Is it open for anyone who is willing, or is it only for psychologists? Good question. Thank you for that, Collins. Collins is one of the people, you know, our youth group members who did this from Kibera, and so I'm happy that he's with us today. This course is open to everyone. However, people working directly with persons with mental health conditions are the ones we are looking to have as a required course. And so when we talk about, for example, the essay, you know, we would be looking to have that from psychology students. In other words, the expectations from psychologists will be more as we do this course. And even when we talk about having mandatory training or for it to be in the curriculum, will be for psychologists. However, the course is open to us. We wanted to start with the School of Applied Health Sciences because you're the ones more likely to work with people with mental health conditions. As you start the course, you'll find that there are some technical issues in there, and even issues of legal capacity and so on. You'll find a lot of the times it's people working with persons with mental health conditions that will really need it. So the reason why we put it as, you know, from the School of Applied Health Sciences is because we want to ensure that professionals working with people with mental health conditions are empowered first. Yeah, so I hope that is clear. We do have, you know, this poster went to, you know, other universities, USIU, Strathmore, and we are in discussions. Like we said, this is a pilot with you. The courses after that, I look forward to people in this team facilitating it for other universities. And so once we do it, we will have the capacity to do it with anyone else. Because once you've done quality rights, you can facilitate it. It's simple. Yes. So we will reach out to those universities, send us their contacts. We can plan with them. And as you send them, be part of the team that will be the ones facilitating it for them. Asanteni sana for your patience, for your time, for your participation. This is the start. See you in 2 weeks. Asante. Okay, so we are officially closed. Kwaherini.
Thank you. Thank you very much.